It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
All right, our first guest today is Dr. Stewart Kerr. Dr. Kerr is a certified orthopedic surgeon with clinical focus on comprehensive neck and spine surgery, fracture repair, and joint replacement. Orthopedics Specialists of Seattle.com for more information. And Shannon, the spine and the neck, obviously these are things that are very tedious at times, especially as the older we get.
Absolutely, Tom. Pretty complicated area. Obviously, the cervical, thoracic, and lumbar spine have a lot of moving parts, and Dr. Kerr is going to talk about cervical spine and cervical disc replacement. But before we get there, I want to give Dr. Kerr and all the veterans a big shout out. A couple days ago was Veterans Day. Dr. Kerr served in the Navy as a surgeon and gave effort to this country along with all the other veterans. Thank you.
We certainly salute them. And here is Shannon O'Kelly and Dr. Stewart Kerr.
Dr. Kerr, welcome to Health Talk. How are you doing today?
I'm doing really well. How about yourself?
I'm doing wonderful. Thanks for joining us. Our topic today is going to be cervical disc replacement, but I always like to take an opportunity and talk to our guest about kind of how they got interested in medicine, their area of practice, their area of focus, and their background. And I just got to give you a real big shout out, Dr. Kerr. I looked at your bio. That is very impressive. I mean, thank you for your service. You spent time with the Navy SEALs, went to medical school, rejoined the Army, and became a physician and orthopedic surgeon in the Army. And your service is appreciated.
Well, actually, in the Navy.
Okay, well, let's make sure that's right. Thank you for correcting that. I mean, how do you feel about the Army-Navy game? Tell us about your background.
Go Navy, beat Army.
Yeah, there you go. Yeah.
I've actually worked with the Army a lot because I've done a lot of joint assignments. But I just had a delightful career in the service, and I really enjoyed it. I was in for over 28 years, and was able to do a lot of interesting things and work with great teams. It was a very special time.
And tell us about your training and your practice and your background and your area of interest in orthopedics.
Well, you had asked earlier about what, got me interested in medicine and orthopedics. And I think a big part of that, so I grew up in Seattle. I in the kind of Seahurst, Normandy Park, Burien area, went to Highland High School on the South End. And, well, all through my upbringing, my dad was a career firefighter paramedic with Seattle Fire Department. He was in class number 2. So he was one of the senior guys. And, he always had a lot of interesting stories. And as I, started getting into my, probably 4th, 5th grade years in school, I was always really interested in some of the stories and injuries in particular that he would see at work, to the point where I was able to occasionally get permission from their director to do some ride-alongs while my dad was doing a shift, and really just became acutely interested in, seeing and taking care of people. And that's something that I, did while I was in the Navy for 28 years. And a big part of that was, I think, getting people back to really high levels of function, following an injury or following, some type of a, degenerative condition or disorder that oftentimes required, medical and even surgical intervention. So that's really been a big focus in my practice.
Talk about getting great experience. Talk about high level function. You dealt with Delta Force, Special Forces, Navy SEAL. Those folks are high level athletes and quite high level function. So let's talk about the cervical spine. Maybe tell us about it from an anatomical standpoint. Let's do Anatomy 101. Then we'll talk about the cervical disc and then get into the procedure replacing it.
Okay. So in general terms, the cervical spine is the portion of the vertebral column that connects and provides structural support from the base of the skull or the cranium down to the thoracic spine, which is the rib cage bearing spine. So it's what we commonly know as the neck. Neck conditions, can involve injuries where a disc herniates out and pushes on either the exiting nerve root or the spinal cord. It also can just be wear and tear, where eventually the disc kind of wears down and kind of loses some of its height. When I was back in the military, I really had a very keen interest in, not taking somebody that had a disc herniation, a soft disc herniation. To me, it didn't make a lot of sense to, do a fusion of those vertebrae after I removed the offending disc, if you will, that was pushing back towards the spinal cord. So oftentimes in those patients, because they wouldn't really have a lot of bony arthritis, we would offer them a cervical disc replacement.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
We're continuing our conversation now with Dr. Stewart Kerr and Shannon O'Kelly about the neck and spine.
Dr. Kerr, thank you for taking time to talk to us about cervical disc replacement. Just to catch our listeners up, we were talking in the previous segment. Basically what happens is sometimes that disc wears out, sometimes it becomes herniated, and you take the disc out, remove the herniation, and sometimes you need to fuse it. But you also mentioned there's an option for a cervical disc replacement.
So the cervical disc replacement is a device that we insert where the disc that was removed in order to decompress the spinal cord or the nerve roots, and we've freed up those nerve structures. We have to backfill the access point, or we have to replace where that disc used to be at. And that's where a disc replacement can be very helpful. It's essentially a device that typically has a metal upper plate and a metal lower plate. And then there is a polyethylene or even a metal type of dome to that allows us to place that precisely where we need that in the neck to afford continued motion rather than fusing or locking up that segment with a fusion that can be avoided oftentimes.
And so when you're talking about a fusion, just for our listeners' sake, you're talking about taking a metal plate or bone graft and basically fusing those two vertebrae together, stopping the movement altogether. And you and I both know how important cervical rotation, flexion, extension is. A lot of motion at the cervical spine, and a disc allows you to maintain that motion. That sounds pretty important.
It is pretty important, and it can also be important in diminishing or decreasing some of the pressure that we see on some of the adjacent levels of discs within the cervical spine. So a disc replacement sometimes can help avoid transmitting forces from a fused segment up to the adjacent discs and accelerating the wear and tear that we see sometimes with fusion patients.
Tell us about the procedure and the outcomes and the rehab process and return to activity maybe.
Well, I can tell you that both for fusion and for disc replacements, the outcomes from those are both excellent. The disc replacement, we are able to have patients return back quicker. You know, we're talking in the mid to upper 90 percentiles of absolutely excellent results where patients have resolution of their pain and can get back to a very active life. The main difference is that we don't have to put someone in a cervical collar to kind of immobilize the neck after a disc replacement. We have a small incision through the front part of the neck that heals in very quickly, and we really encourage patients to get back to moving their neck right away after the operation.
Typical return to activity, is this something like 8 to 10 weeks, or what do you find?
Well, for most activities, they can get back to those in oftentimes just several days. But when you're talking about unrestricted activities, normally about 8 weeks, because what we want to have happen is we want to allow for ingrowth of the bone to the prosthesis or the implant. We want that to remain fixed within that bony segment. And that takes time. That's just biology, and it normally takes 6 to 8 weeks for that to occur.
Dr. Kerr, thank you so much for your time and information regarding cervical disc replacement. Thanks for joining us. I appreciate your time.
I appreciate you having me. Thanks very much.
You've been listening to decorated U.S. Navy combat veteran and orthopedic surgeon Dr. Stewart Kerr as we talk about the neck and the spine. Shannon, as we mentioned at the very beginning, the neck and the spine, especially as we grow older, when you look at the configuration of the spine, there's a lot that can go wrong.
That's right, Tom. Those cervical discs that normally separate those vertebral bodies, they degenerate over time. If you can do an interventional surgery to put a new cervical disc in there and space those bones out, relieve pain and increase function, that's phenomenal.
Talking about vaping in our next segment right after this time out on Como. More with Dr. Stewart Kerr and Shannon O'Kelly after this time out on Como.